are in a unique position at Reddington Fairview. Geographically, we are at the intersection of a very high volume of users of mental health services. We have seen a increase not only in volume of people seeking psychiatric or behavioral health services, but subjectively, I can clearly say that the acuity has certainly increased.
The boarding of psychiatric patients in the emergency departments has been a problem for many, many years. The fact that folks are boarding in emergency departments that need psychiatric care is indicative of two problems. One, a lack of community resources, and secondly, a lack of beds for acute care inpatient stays. And that's part of our capital campaign and our commitment to the community to add more beds here at Acadia Hospital.
We realize that as the mental health needs of the community have changed, a lot of the care is going to be provided external to the hospital. And that's why we need to develop a robust service of outpatient, not outpatient as in traditional, but really get into the field, get into offices of primary care, ED, other places.
So we started to get creative on ways that we could take our services closer to the patient, closer to the families, to get out in the community where those services are really needed most.
The Acadia Psychiatric Council team was formed years ago to provide psychiatric support at the emergency room.
The consult service program provides much needed services in hospitals virtually. It's really about early detection and early intervention. And the consult team does a fabulous job in addressing the needs.
Any of the hospitals can call in and request us to become involved in a case, and so they call the Acadia Behavioral Health Resource Center. We have an entire team of well-trained people who work with their patients directly over Zoom and can get them started on psychiatric medications, referrals to outpatient programs such as therapy or other medication management. We send them to crisis stabilization units, and we're also a link to psychiatric hospitalization.
With our Acadia telepsychiatry providers, we start the care in the emergency department almost from time zero, whereas when people are waiting hours, days, weeks for beds, some that went untreated or unstarted. Now we start nearly immediately. Clearly a game changer. Having telepsychiatry is integral to what we do. Instead of having to be transferred to a psychiatric hospital, those people can get started on medicine by a mental health expert, psychiatrist, nurse practitioner, and they become stable enough they can be discharged and continue their care as an outpatient.
Really, our success down the road is going to be managing this illness in the community and minimizing the number of episodes where people are experiencing an escalation of that illness to a crisis state. So that's where all of our effort is going, is really in the community to do a better job with early detection and early intervention to keep people out of the hospitals and out of the emergency departments.
I'm proud to say that Northern Light Acadia has really taken a spearhead and really getting this moving. We have really kind of extended our services beyond the four walls of the hospital.
There are a few opportunities in medicine to really take giant steps forward. This is clearly a giant step forward.